Welcome you all. In this video, we will discuss about the GCS scale and its components. First of all, the definition of GCS scale. GCS stands for Glasgow Coma Scale, which used to measure objectively describe the extent of impaired level of consciousness all type of acute medical and trauma patients. Objectively means based on the observable facts rather than the feeling or opinion of the patient. And consciousness means the state of being aware of and responsive to the one's surrounding. So in GCS scale, we check both level of consciousness level and also neurological responses of the patient, means both wakefulness and awareness level. In other words, GCS used to describe the general level of consciousness in the patient with the traumatic brain injury, means the severity of brain injury and coma, used in medical setting around the world to evaluate the level of consciousness and neurological functions in the patients. Let's talk about the invention of GCS scale. The Glasgow Coma Scale was first published in 1974 at the University of Glasgow, Scotland, UK by the neurosurgery professors Graham Teasdale and Brian Janet. Let's talk about the components of GCS scales. So there are three components of GCS scale. The first is eye-opening response, the second is verbal response, and the third is motor response. Let's discuss one by one. First is eye-opening response. There are four components of eye-opening response. Component number 4, spontaneously opening. Component number 3, to the speech. Component number 2, to the pen. And component number 1, no response. If the patient is opening his eye spontaneously, then we give 4 score. If the patient is opening his eyes to the speech, then we give 3 score. And if the patient is opening his eyes to the pain on his body area, then we give 2 score. And the patient is not opening his eyes after doing above all and still no responses, we give 0 score. Sorry, not 0, but 1 score. So the maximum eye response is 4 and the minimum eye response is 1. Next we have verbal response. We have total 5 components of verbal response. So number 5, oriented to time, place and person. Number 4, confused. Number 3, inappropriate. Number 2, incomprehensible sound, and number 1, no response. So if we ask from the patient his name, time, place and location, when he replied correctly, then we give 5 score. If the patient is still confused, we give 4 score. And when the patient use inappropriate words, then we give 3 score. And when the patient use incomprehensible sound, then we give 2 score. And when the patient give no response, then we give 1 score. So at the last we have motor response. So we have 6 components in motor response. Component number 6, obey the command. Component number 5, move to the localized pain. Component number 4, flex to withdraw from pain. Component number 3, abnormal flexion. Component number 2, abnormal extension. And component number 1, no response. If the patient obey the commands like raise the hand, if the patient raise the hand correctly, then we give 6 score. If the patient moves to the localized pen, we give 5 score. So we give 5 score. And if the patient is flexed to withdrawal from pen, we give 4 score. And if the patient show abnormal flexion, we give 3 score. And also when the patient show abnormal extension, we give 2 score. And when the patient show no any body movement, then we can give 1 score. This is all about the GCS scale. If you like the video, please like, subscribe and share the video. Thanks for watching.